Hello, everybody. Nice to see you all again and be with you. This is me, Ben Calder, for the Bowen Therapy Professional Association, the BTPA, here in the UK. And we've got another really interesting interview for you today. We're going to be speaking to Australian oncology massage specialist, Bowen practitioner, Eleanor Oyston. Now, Eleanor has got decades of experience working initially in science and medical tech, diagnosing cancer, working in pathology labs, and working in developmental neuroscience. She then started doing remedial massage and Bowen Technique, and then started developing oncology massage training through to the founding of a company called Oncology Massage Limited in 2009, involved in research around oncology massage, up to the foundation of Oncology Massage Global in 2017. And Eleanor and I are going to be speaking about some fascinating stuff. And I know this is something that's come up many times in the Bowen forums and the groups, is about whether or not it's safe to do oncology massage, working with people with cancer diagnosis. One of the things Eleanor's kindly given us, which you'll find down in the resources as well, is just a guide on oncology massage. And we're also going to put links in there to Oncology Massage Global as well, who do an online training program for anybody that really wants to dive into understanding this, and something that Eleanor really recommends. Plus, we'll stick a link into her book as well, Touching Cancer. Now, this is a beautiful interview. It's, really, really warm and lovely, and I know you're all going to enjoy it. So let's not waste any more time. Let's get into speaking to Eleanor herself. Eleanor, thank you so much for being with us today. It's an absolute pleasure to have you come and talk to the BTPA, the Bowen Therapy Professional Association, here in the UK.
It's a pleasure to be here, Ben, and lovely to meet you.
Yeah, absolutely, absolutely. Now, as I said in the intro, I first came across your work from the recent Tom Bowen documentary. That's where I caught your name and thought, I've not come across this name before. I need to learn more, and took myself into a little dive into your world. And I'm now really so grateful that you're here to talk with us and share some of your knowledge and wealth of experience that you've got there. But for anybody else that's not come across you before, I'm wondering if you could just give us an introduction into how you got to where you are today. Where did it all begin, and how are you here now?
What a lovely thing to be able to tell your story. So I'll be as brief as I can, but I'll just give you the bones. I was a little budding scientist at high school, and I went to a school where only 5 of us went to tertiary education. So it was Western Sydney and migrant communities, and believe it or not, it was the middle of the last century in the mid-60s, and I got into a very respected course. There were only 26 of us in New South Wales, and it was called medical technology. And I did 1 year full-time, and there was 5 years part-time, and you had to be working in an approved laboratory. So I started at a time when women were supposed to stay home and have babies, and I wanted to be a scientist. And it was fertile ground. If you're curious and you're interested, they gave you really interesting things to do. And they did the first heart transplant when I worked at St Vincent's Hospital. We had the soldiers coming from Vietnam on R&R, and they all had rare diseases, so it was a really full of fruit in the profession, and it was growing very quickly. And then I got married very young, as people did back then, and my husband was in the Navy for 37 years, and that gave me an opportunity to change jobs. Every time we got a posting, I had to recreate myself, and that was great fun because I'd had good basic training, I had an excellent education, and I had a stable life, really, even though we moved a lot. The income was very fortnightly. It came in, whatever happened, and that gave me opportunities to pick and choose jobs that I wanted to do. And it was exciting. I loved it. And when I decided to have children, I specialised in a part of science called diagnostic cytology. So it's looking down the microscope at pap smears and sputums and fine needle biopsies and those sorts of things. So I knew lots about cancer. That's what I did every day. I diagnosed cancer down the microscope. I didn't know a lot about consequences of what that diagnosis meant to people, but I learned a lot more about that in the last 25 years, massaging people with cancer. But I knew a lot of science. When I went into research. I was at a dinner party one night when I was in my 40s, and someone said, "So what do you do for a living, Eleanor?" And I said, "I diagnose cancer while I'm growing my own." And I went, "Oh my goodness, I better listen to myself and find my path." And so I left my job in diagnostic cytology and I found a job in medical research. And it was a developmental neuroscience laboratory, and we were looking at isolating nerve growth factors from bovine heart to grow nerves in test tubes. So I knew lots about cancer, and then suddenly I knew lots about nerves. You know, it was 10 of the most exciting years because it was such a young world. And I looked after PhD students. I taught them how to use equipment. I helped them work out their research project so that they could afford to do that research. I helped them print their thesis at 2:00 in the morning. It was just really great time. While I was there, I wanted to do a degree at Canberra University, and it was called health education degree. And it wasn't about bathing babies. It was about the philosophy of health. It was all about, World Bank and money in the pharmaceutical industry. And I spent 6 months with my teeth clenched when I did sociology in that, looking at that paradigm from a sociological perspective. And I got really interested in public health issues. I realized that I actually went for a foot reflexology treatment because someone was telling me about it. And I said, "There's no science. That's a load of bunkum. That can't be good for you." So I went and had a foot reflexology treatment, and I went, "My goodness, what the heck's that?" Because that was absolutely fantastic. So I thought I'll do a course on foot reflexology, and then I didn't leave massage school. I did. I kept going and going, and I got lots of exemptions because of my science background, and people all thought, "Wow, she must be really clever." But I found this whole world that I had no idea about. It's just not addressed in any form in the medical paradigm. And I mean, I finished my massage training one week, and the following week I taught pathophysiology to the same group of students because they weren't even teaching pathology to massage students. And they needed to know about cancer and diabetes and heart disease, just the common, not the rare things, just the stuff that everybody was hearing about and living with. It was, that was fascinating. And while I was studying remedial massage, I came across a guy called Russell Sturgis who was teaching Bowen. And my friend said, "You got to try Bowen." And I enrolled for his course because he was the only person then coming to Canberra where I lived. And he was just amazing, talked such sense, and it just made sense. The biology made sense, the way he taught it, because a lot of his biology is based on epigenetics, and which isn't much more, that wasn't around 25 years ago, but it is now. And he just made all the things that I'd seen down the microscope. I could look at cells, interestingly, and go, "They're telling us so much more. Why are we only looking at this aspect of them?" And things like oat cell carcinoma of the lung, they are the most closed, tight, you can't see them. It's hard to find them. They look like histiocytes. They look like normal cells. They're tricksters. And every person that I've met with oat cell carcinoma of the lung, that's their personality. They're closed, they're shut down, they're hard to see into, they're very, very private. And I gradually began to, through my massage time, I began to work with people with cancer when I was a very new graduate of massage. But I knew what I was feeling. I knew what an ascites was. I knew what edema was. I knew how lymphatic flow worked. I knew how nerve cells regenerated in certain parts of the body and not in others. Like I had this 30-odd years of knowledge, of understanding, and then I was using my hands and my science came alive in my hands. And there was Russell with me ringing him up saying, "Hey, Russell, what did I do when I did that?" He'd say, "Oh, that's just a histamine release, they won't die of that. Oh, that's good. Tell them just to drink water." Okay. So I had tremendous mentors and they believed in me. They would ponder with me. I'd say, what's going on? What's this? What's the science behind this? And they would come with me on that academic journey, and we'd look up research papers, and it was a very exciting time. Ben, I'm waffling. Keep me on track.
I'm beautifully fascinated in what's going on there. And I'm, just this transition between having been what I would see as very left brain or almost like object fascinated to begin with, that it was about what you were seeing in the lab and then translating that to something that's an experience under your fingertips. I mean, to me, that sounds like it was an incredible awakening and an incredible shift into a part of you that just hadn't been realized before then.
Absolutely. It was, and the professor I worked for, who I loved dearly, he said to me one day, "Eleanor, if you can believe all that, you've got a cleaved brain, like a cloven hoof, Well, and that's what it felt like. It felt like this bit was telling me that one thing and this bit was telling me another. And at one stage, the teacher at massage school talked about Findhorn in Scotland, which you probably know about, and how they
Very
grow
well.
cabbages by the moon, And I'm going, what am I doing in this lecture? This is such bunkum. And, 12 months later, I'm teaching it. Like I'm telling people, go to Findhorn, go volunteer, do something exciting and get a real grasp of the spirit, of spirituality and the energy systems that we're so naive about. Absolutely. But anyway, so I thought it was great.
It's interesting you mentioned Findhorn as well, because actually I did part of my growing up not far from there. My father lived up in Forres for very many years, and he would always tell, he was in the RAF up there, and would always tell jokes about how one of the reasons that the Cullen Gardens were so successful is because when it was still part of the old military bases, that was one of the places where they used to put all the night soil. So it spent quite a lot of time percolating the soil there. But yeah, it really is. And it's funny because I was almost the other side of that coin. I very much grew up more on the complementary side of things in the alternative world. And that in itself, I think, it's kind of like the medical establishment to a degree was seen as this thing not to be trusted. And I can understand from a psychological point of view why certain people move towards certain directions within that. But in the last kind of 14, 15 years or so, to really understand that need for that integrative approach, that we can't do one or the other. We need to do the both. And we need to look at what they're both best at and get them to do what they're best at, because they're not trying to create the same outcomes. They're not looking at the world in the same ways, but they both have value. And using that combined value is actually what's going to give us the better outcome.
Yeah, and it's when I teach oncology massage or Bowen, I say it's a smorgasbord. It's not them or us. To have respectful integration, it's about mutual respect, and they won't respect us until we learn a little bit of their language. The reason the doors opened to me in many times over the last 25 years was that I could speak the language. I could talk science, and they knew that I knew what I was saying scientifically, and that made a huge difference. I used to say to students, if I had a blue chip, give you 20, I'd give it and we put it behind your left ear, and then we'd start talking about oncology massage, because you'd have the background and all the understanding of the science of what we're actually doing. But the basic science, I think, of most tactile therapies is to elicit the response of the relaxation response, which was identified by a fellow called, his book's up on the shelf, I can't remember his name. Anyway, it's a doctor. Oh, that's so annoying. Anyway, mustn't be important. And he identified the relaxation response and how that changed the physiology of the body, the neurotransmitters, the epigenetics. And when the body goes from stress to relaxation, the physiology of the body changes. And when I went to the Olivia Newton-John Hospital to ask them to let me bring my training into their hospital, the professor that I met, the head of oncology, he said to me, when you do your stuff, when you do that, can you see any difference in the patient? And I said, yes, I can. What I think I see when they get up off the table is an anandamide, the feel-good hormone. That's what and it changes their faces, relax. The lines are softer in their face. And he said to me, if you can see it, we can prove it. And he was the main instigator of getting the oncology massage into the hospital. It was driven by Olivia Newton-John because she knew about it. She wanted to have it there, but he made it happen. And I spoke to 42 oncologists in the one room. My goodness, that was a day. And at the end of my talk, he said to them, if you want to know anything more about oncology massage, talk to Eleanor. We are having it in our hospital. So, don't argue, guys and gals. This is coming. And without that driver inside the system, I was driving it from the outside, but he was driving it from the inside. And it worked like an absolute treat. It was amazing. We took 6 students through every 6 months and they were trained in the hospital. And mainly oncology massage is about touch that does no harm, which is Bowen's.
Mm-hmm.
Bowen is the touch that does no harm. So I couldn't have developed the techniques around oncology massage the way I did without a strong understanding of fascia and thixotrophy and how the cells stay a set distance apart because they're lubricated appropriately. It was a combination of what I'd learnt in massage school and from the Bowen community that I could bring to stations around what we were doing when we went into the high care wards, where we worked with dying people, where we worked with newly diagnosed people or people that had gone to theatre and come back, and we were the first person that went into the room after the nurse and they'd just been told there was nothing that could be done for them. And, all we did was put our hands on them. All we did was hold them in their suffering without judgment or criticism. And, people physiologically respond to that. And it doesn't have to be labeled something like love or compassion, or it doesn't need the big words. It just needs to be human and forgiving of whatever humanity has brought to you in that moment. So which is pretty much like kinesiology, really, isn't it?
I just find it really interesting that when we think about sense development on an evolutionary point of view, touch and pressure, heat and so on were developed within nervous systems way before sight, sound, taste, smell. And so it's got a really ancient pathway in comparison to those other senses. And when you look at the studies that have been done, mainly with animals in failure to thrive, where they're not allowed any contact, and some of the obscure study results where they've been looking at, I think one of the ones was they were trying to develop cholesterol and looking at cholesterol in rabbits. And there was a group of rabbits that just weren't conforming to the study, and they found out it's because they were being handled by the people that were feeding them and being given love, and just how that completely skewed the results within the studies. And so it's funny because it's almost like there's been this left-right brain separation, as you mentioned it when we were speaking before, the cloven hoof, this idea of something being separate. There's research that shows there's a failure to thrive if there's a lack of touch. And then there's touch therapists that know that by doing a touch practice of some kind that people thrive. And it's kind of like that, trying to bring those two together seems to have been, it's one of those things that there's such an obvious pathway to it, but it seems to have been resisted.
Well, there's no money to be made. There's no money. There's no financial gain for anybody. If your loved ones can help you heal, there's no one making any money out of that. And that's equally for the complementary therapies community as well as the medical paradigm. It's the cultural norms. And the belief system I find is amazing how powerful the no-touch paradigm has become. You know, children at school can't be cuddled if they've hurt themselves. We've created a circumstance where we get sicker and we need more and more medication. And I don't want to go into that because I'm not anti-science. I've seen the best of it, but I've also seen the worst of it. And I think we got opportunities to be kind to each other in medicine and to be kind to each other in complementary medicine. And I haven't met anyone in medicine who isn't there for the right reason. And I haven't met anyone in complementary medicine who isn't there for the right reason to serve our fellow man, and whatever way we can. It's a system. It's a system that is letting us down, and we can get around that. You know, the 5 years of this research fellowship with the University of Technology in Sydney was run by an English guy called Distinguished Professor John Adams. And he's looking at integrative medicine from a public health perspective. So what he's saying is, if we ignore complementary medicine, then we are denying the public health benefits of it. So in Germany, people go to a Heilpraktiker, which is a naturopath. And if the naturopath can't figure out their exercise, their food, their supplements, then they go to the doctor. Then they have pharmaceuticals. So we've missed the boat with that in so many ways, because doesn't that seem it was the logic of my childhood when the GP came and sat on the edge of my father's bed and said, so Davey, what's wrong? And my dad said, well, my son is stealing hubcaps and I'm really worried about him. And he said, well, that's why you're sick. You know, so you got to have these tests. So I find out that there's nothing worse happening. But I think you come to terms with this boy and you'll get better. And you know what? He did. He got better because someone knew him. Someone listened to him. Someone knew what his deep suffering was at an emotional level. And we're getting there, Ben. We're getting there. It's, you know, I've only spent 25 years in complementary medicine. You know, I wish I had another 25, not to do anything differently, but just to see how magnificently things are going to change. Because we've got the caliber of commitment in the complementary therapies world. We're not alone in wanting excellence, wanting the standards to rise, wanting to be respected by the medical community, but respect has to be earned. And we have to be careful what we profess to believe in, because sometimes it is hogwash and we need to lay it aside. And sometimes it's pearls of wisdom, and we need to find ways of conveying that in a safe, kind, gentle way, and not to create a war. You know?
Yeah.
If it becomes a fight, it becomes a battle and someone loses.
Yeah. Yeah.
Someone
and
has
there's
to
so
lose.
much to be gained.
Yeah.
There's so much going on there that, and again, even in my kind of 22 years professional practice now, to be able to see the difference of how that willingness to be open is shifting. And in the UK, unfortunately, it's down to the fact that the medical services are overwhelmed and underfunded. So, you know, with too much money going in the wrong places and not enough where it's needed. And they've almost got no choice, and patients waiting so long for treatment that they're going and sourcing it themselves and dealing with it privately, and then going back to their GPs or their consultants, whoever, and said, look, this has made a difference for me, this has helped. And they're just being a greater openness in that process, which is fabulous.
Yeah, it's amazing. I think one of the most interesting things about oncology, because I really want to talk some more about that, is that there's so much fear. I mean, 25 years ago, there was much more fear. People would say, oh, that's a death sentence. And it was from diagnosis. Whereas today we have amazing progress in things like chemotherapy and radiotherapy. The machines in radiotherapy are amazing. They're like magic, and they do wonderful things with them. And chemotherapy does have side effects, but they're managing those as well. Many, many more people now living well with cancer and having had a diagnosis of cancer, and they live well. And our statistics in Australia are that 1 in 2 people will have cancer at least once in their lifetime if they live to 75. That's all of us, really. It's a lot of cancer. So if we say to people, don't touch, we're creating modern day lepers, because the opposite is true. So when they say exercise is really good for people with cancer, we create the same neurochemistry with gentle and safe touch as you do when you get on your push bike and you go for a ride in the sunshine. It's the same chemical pathways. So it's really important that we teach therapists how to, first of all, manage their own belief system around cancer. Because if you're massaging or bowening someone and you're thinking, oh, you poor thing, all of that your belief systems are transmitted to the other. And you are feeding into their fear. Whereas if you can work with a level of belief that says, I can't fix you, change you, or make you better, but I can walk this path. I can stay in your circle of influence. I can be on your board of directors. I can help you find the right tactile therapist for you, whether it's massage or Bowen or shiatsu or acupuncture, or, let's become a resource for each other and work out how to create a path ahead. And teaching therapists that it's safe is the hardest thing. The phone calls, the most phone calls I get are, did I hurt her or him, or can I do this? Can I touch my mother or my grandmother? Can you touch them? This is just crazy stuff. So just teaching a few basic techniques, which we do on our online program, which is brilliant, by the way, but it's not rocket science. It's just simple. It's simple, gentle kindness. And when I first started working with people with cancer on the Quest for Life programs, which is a retreat centre in New South Wales where people go for a week, and basically, fast forward, it's not a retreat, but we call it a retreat. People go to explore their emotional journey, and we offer counselling and massage. And I started massaging about 400 people a year on those programs. And that's where I developed the techniques and did the research so that I could teach the important things. And there was a book in America. There was a woman who came to Australia to teach for me, to help me, to guide me. And her name's Gail McDonald, and she's only just retired too. And they were about 15 years ahead of me in their integration of their acceptance into the medical world and to the local community. So she was a tremendous resource. And the New South Wales Cancer Council paid me $30,000 to bring her to Australia and to take her to do lectures up and down the south coast of New South Wales. And I thought, wow, this is easy. Look at all these people we're talking to, and look how influential they are. And she went home and nothing happened.
Yeah.
Nothing more happened. There was just me in the wilderness saying, we need to get these courses accredited. We need to get them into hospitals. We need to have ethics committee approval. We need, and it was lonely. It was lonely. People came. Therapists emerged out of the sea of people that came to do the training, that had the skills, that had the passion and the resources to help it to blossom. But the actual therapists themselves were more worried about doing harm than anything else, and convincing them that they could do no harm with Bowen. You can't. You physically can't. And when I showed the doctors what we did in the hospital, the oncologist kind of moved. They said, that won't do anything. Well, it does. It does stuff. Don't ask me to give you a science lesson because you'd pull it apart. But I know that it makes a difference to people. And one of the best ones was I was on a retreat program and these people came from in the country out west in Australia, no resources at all. And he'd had lung cancer and he was having treatment and he was in a lot of pain. So I said, we'll try Bowen and see what happens. I don't know if it'll help or not. Won't make it any worse if it doesn't make it any better. And she said, can I watch? And I said, sure. So she came into the treatment room and she said, can I feel what you're feeling? So we put our hands on his chest and it was hot. It was burning hot. It was an upper apex tumour and it was large and it was aggressive. And we felt the heat. So I did a Bowen treatment and a nice bit of reflexology and a head massage, and he was like putty in my hands. He was like a baby. He was gorgeous. And then at the end of it, I sat him up on the edge of the table. I was just going to go because I could see that we'd got a good result. And his wife said, oh, can I feel the hot bit? And she went to feel the hot bit and it wasn't hot anymore. It wasn't hot. It was the same temperature as the rest of his body. Hot patches around the body are really good indicators that Bowen needs to release something. It needs to let something let go. So I rang Russell and said, so what do you reckon? What do you reckon I did? And he said, oh, you just eased the traffic jam because all the natural killer cells, all the defense cells had gathered around the tumour to contain it and to do their best, because every cell in your body is programmed to heal. Our job is to find the environment in which that can happen. So that you just release the traffic jam and everything got a bit easier and the immune system didn't have to work so hard. And I thought, great, I'll buy that. I'll take that on board. Empower people to understand the positive outcome of relaxation. And there's lots of science now around that, especially with Robert Schleipp from Germany. He's a dream. He's just been... The first time I saw one of his videos, it was at a Bowen conference in Melbourne, and it shows a phagocytosing cell moving through the fascia, and I just almost leapt up and kissed the screen. I thought, that's it. If the cells are that clever that they can show that through the fascia, we can create a fascial plane that will allow healing to facilitate itself. It's so exciting. And it's coming. This is what's coming to our industry. And it's time. Yeah. So we can see it now. We can see what the cells are doing with scanning electron microscopy. 25 years ago we had it, but no one was looking for what we needed them to look for. Whereas now we've got scientists looking for what we need them to prove. And it's coming up top. Anyway, sorry. Ask me another question.
Do not apologize, Eleanor. Honestly, I know that everybody who's listening is going to be fascinated by this. But I'm kind of curious as well, because the question that I've seen most commonly around cancer when it's coming through the Bowen groups and so on is it safe? Because again, you touched beautifully on the fact that there's that concern about doing harm. And from that, there's the secondary concern about possible litigation within the background of it. So for you, what are the parameters in which it is safe to do Bowen? What are the kind of the guidelines that our audience can take away as if you're this, you're going to be fine. If you're this, you might not be fine.
Well, I have to. This is going to sound like a publicity spiel, but the reason I'm passionate about oncology massage is that it's so important to do the training. It's so important, and there are really good schools of training, and it's not to keep everyone safe. And I've had doctors ring me up and say, look, my patient was bruised when your therapist massaged them, and I'll get you struck off. That had all sorts of things happen to me over the last 25 years because it was too new. It was people, and yes, they do. You will bruise someone if they've got low platelets and you work too deeply. So it's about working with the body that is in front of you, not the textbook that you learnt from. So adapting to the body you can do easily if you actually understand the processes that are happening in the body. And that's what our training programs are all about. It's all about empowering people to know when to touch, when not to touch. To do this move, don't do that move. Like they say, don't do a coccyx move on a pregnant lady. Well, you ask someone who's 9 months pregnant, do they want to have the coccyx move? And they say, go for it, whatever you want to do, get this baby out, But, and it's the same with cancer, when people are so suffering emotionally and physically, they want relief. And we can provide that often. Most of the time, it's not a panacea. There's no one way, but we do a lot of holds. We do a lot of holding, of cradling of the body, and gentle touch, gentle work, and a lot of foot rubbing. I think there's more to Jesus washing foot than meets the eye, So there's a lot of relaxation response can be generated by the right amount of touch. I've got a story. I've got a million stories in my head. The one that's coming to mind at the moment was a woman with brain tumor who was an academic, and she came to me for Bowen or oncology massage for the last 6 months of her life. And her husband used to drop her off, but he was always late. He was always late getting her there to me, and after a while she couldn't. So I had this feeling he thought it was a waste of time because he was also an academic, and he thought, just stick with the doctors. So anyway, but he brought her. For 6 months, he'd bring her. And then I lost touch. She stopped coming because she couldn't get out of the wheelchair and onto the table. Those sorts of things happen. Then one Sunday afternoon, I got a phone call from her husband saying she's dying and she's fitting. We can't stop the fitting. The medication's not working. So can you come? Because she really liked what you did with her. And I said, of course. So I went. Her 2 daughters were there and holding the vigil, as we do. And she was fitting. And I said, I don't know what Bowen moves I did, but I did some neck moves and I did some upper shoulder moves and some Tom's cranial move. I did that. And then I rubbed her feet and gently stroked her legs. An oncology massage technique and leg technique that we teach, and she stopped fitting. She stopped fitting by about the 3rd Bowen move. And I just kept going because I couldn't believe it, right? I just thought, I haven't done enough. I have to do a bit more and I have to keep touching, and the daughters witnessed it and said, my goodness, what have you done? And I said, I don't know. My hands did it. My heart did it. My head has no idea what's going on. I went away and I showed them how to do the leg moves that we teach in oncology massage classes. I taught them that, and they were doing it beautifully when I left. And they rang me the next night and said she didn't have another fit until she died at 3:00 in the morning. What is that? What is that? So
it's beautiful is what it is. That gift of human care and human love, being able to
But I had to justify. I had to justify the technique. I had to justify. I wrote and wrote and wrote every move I made that day, so that it was all written down, so that I could debate it if I had to. And you have to be prepared to debate it. You have to be, and therefore you've got to really know what you're doing. You've got to know the names of the muscles. You've got to know the attachment points. You've got to know the fascial planes and how the anatomy trains work in the body. So, and it's like understanding acupuncture. I went to a conference. It was the Society of Integrative Oncology. It's a medical body. for integrative oncology. So they had their very inaugural meeting was in Times Square, the Marriott Hotel in Times Square, and in New York. And my neighbour gifted me money to go to that conference. So I went to the conference and they talked about acupuncture and sham acupuncture. How do you do sham acupuncture? And you can't do sham touch. Someone's touched you, they've touched you, you know. So none of the techniques that were being used in this research were transferable to touch, to oncology massage. And at the end of the conference, I said to the Australian professor who was presenting there, who I didn't know until that day anyway, I said to him at the end of the conference, so when am I coming, because they did talk about how positive oncology massage was, when am I coming to your hospital to set up a oncology massage unit? And he said, I don't like massage. You know, like, there's no answer. What do you say back to that? You know,
sure.
Of course he's not going to let it progress. Of course he's not going to be interested in research around tactile therapies. So that's why we've got to do it. And this is why this capacity building work that I've been doing with UTS for the last 5 years is so important. We as a community have to get validated research tools that we have in our clinics, that we learn how to use, and we do it on every single patient. And by the end of the year, we publish one paper, one case study, one set of information that we've gathered. It's not a big commitment, but it is a commitment. And until we do that, the medical world will keep us out. And they will deny this amazing technique for people that are desperately in need of it. So, and you know, I didn't hear from the husband at all because he thought it was a load of bunkum. I didn't hear from him. So, and I felt really disappointed because, not that I wanted him to say, well done, Eleanor. I wanted him to say, I'm so glad you could create the relief, you know, whatever you did, rather
and it's
than
interesting
pretending.
that response that you had from the Australian doctor in the conference, you know, like this, we're not talking about a chocolate bar. We're not talking about something I like or I don't like because of the taste in my mouth. It's kind of like, well, you know, can you reflect on the clinical benefits of a thing, and can you see that it has a role to play in, you know, that healing journey, you know, and I always try to be careful around the language I'm using around a thing because I don't want it to move too far into a disconnected space for people that they see it as, you know, something that doesn't have a logical and a reasonable pathway to it. But, you know, so from your experience and your point of view, how do you see touch, the role in that healing journey? What, aside from some of those the more obvious things in there, what do you see it actually doing as a mechanism, and how much of a contribution do you think it can be in towards a remission within people as well?
That's tricky. It's tricky territory because there isn't any magic. What I've learned over 9 years of working in a retreat program for people with cancer, and we had up to 25 people a week, and I lived with them for 5 days a week, Monday to Friday. I lived with these people and their loved ones. They came usually with a partner or a carer. And what I learned is that you can't predict because you can't say this one's going to die and this one's going to live. How could we imagine we could be that arrogant? How could we imagine that? But what I do know is that when you relieve the suffering, the human body responds to the relaxation in a profoundly deep way. And what if healing isn't living? What if healing is a whole range of different things that aren't about the physiology of the body? What if it's about peace? The peace that passes all understanding. What if? So what I know is that for me, I've got a cancer story because I'm 76 years old, right? So I've got a cancer story. And 5 years ago, I was diagnosed with multiple myeloma, right, which is a blood disorder. and it was quite advanced. I had spinal fractures and all kinds in all my bones. So I had to make choices. I chose the best technician I could find as the pathologist that looked after me. He wouldn't communicate with me. He talked to his computer. But what he did for me was excellent technology, excellent techniques. At the end, he said, don't take any of those fancy chemicals, supplements, don't have any natural therapies while I'm working with you. So for the first 12 months, I gave him 12 months, and for 12 months, I only did what he prescribed, and I went from the bed to the couch and the couch to the bed. I was really, really, really sick. What I knew was what I was doing didn't align with my belief system. I respect it. I needed it to get me off the precipice that I was on. That's what most chemotherapy does. It gives people time to make choices. And I knew I had lots more choices. So the first thing I did was find another doctor. I found an amazing Indian woman who talked to me, who understood my paradigm and said, I can't prescribe anything, any supplements for you, but it looks like you've got good advice anyway. I had 3 naturopaths, a kinesiologist, a massage therapist, a Reiki therapist, a Bowen therapist. I had a team. I had a team of people that were like-minded, that believed what I believed was possible, which that my body would regain its strength. And I worked on my psyche. I worked on my sadnesses in life and my belief systems around them. And my body is 5 years down the track, and I was only supposed to live 3 to 5. So I said to the hematologist, should I worry about July? I'm supposed to be checking out in July. And she said, no, Eleanor, I wouldn't worry about that at all if I were you. So, and I've got no idea what happened. I've got no idea. I just followed my belief, and I know that but basically I know that dying's not the end. I believe that there is more, and I don't know what it is, and I'm not a particularly religious person, but I know love never dies, and something changes at the end of your life. The spirit leaves and goes somewhere, I don't know, that's for another talk. But I think, yeah, I don't know where I've gone now. I've got a bit too deep into my own stuff, I think, Ben,
But I think what you're saying, though, has an incredible relevance, certainly from the perspective that I look at health. I mean, we understand cancer as a metabolic disease at a level that we didn't before. You know, we've been able to disperse, I hope, for the most part, with this concept of genetic determinism, that, you know, just because you have the potential markers for it, that it's a done deal and there's nothing you can do about it, and all we can do is delay things a little bit. And even from the integral perspective that I use, Ken Wilber's integral model, where we take on board the fact that the mind and the body and our culture and our environment all interact with one another and all contribute into health, that the body, mind, spirit, they're things that all need their own levels of support. So to be able to work out where we've come out of alignment, out of kilter with whatever it is we've come out of kilter with at whatever level, to be able to make constructive changes in any of those dimensions is going to contribute towards health being restored within the body.
Yeah, I absolutely agree. So when we're working as professionals, as health professionals in this field, we have to know who we are and what we think. It's not enough to maybe understand a bit. You've got to really be prepared to look at who you really are and what you really believe in. And we're all victims of our generation, of our culture. You know, we can't avoid that. We all live on a toxic planet. Our food chain is miles and miles longer than it needs to be. You know, it's shocking, the toxicity that our bodies are adapting to. So we need to understand all that about ourselves, and that might be how we support other people, if that's what our role is going to be on the planet. And it sounds like that's what your role is to support others.
It feels a little bit like that. I have spent a lot of time questioning what am I here to do, and it's kind of like, well, I'm probably just doing it, and maybe I don't need to worry
Yeah.
so much about it, but just carry on with it. I mean, one of the things that I'm kind of curious about as well is, to me, it seems like the frequency of cancer is changing, that there are more cases across more demographics than we've seen before. And in my mind, you hit right on it there by just talking about how toxic the environment is with people. And that in itself perhaps lends a suggestion as to why Bowen is so beneficial within supporting people with cancer, in the fact that the lymphatics and the fascia and just helping the body come back to a state where it's regulating itself is part of what we need to change things. I'd be interested in your thoughts on that.
We can't avoid the toxins. I've got pretty strong views about it. We can't avoid them. What we can do is make as good choices as we can afford to make. There's simple things like buy your fruit and vegetables from the top of the pile. Don't buy the ones that are on the wood, because why aren't there ants or earwigs or normal bugs that are in the garden? Why aren't they crawling around our veggies? Because they've sprayed the benches with insecticide and they've already treated the veggies with chemicals, and now they're getting another dose when they sit in the shops. Common sense things like that. And buy yourself a water filter. The best water filter you can find, and put it in wash your veggies with it. Don't just drink it. Use it. Wash your children's face with it. It's that we're a hydroscopic bag under 2,000 psi pressure. We're just a bag of water and with a little bit of protein hanging out there. So really eating as well as you possibly can, but also look at the old ways we ate food. Look, how would Granny cook a stew? She certainly wouldn't put it in a microwave. And I know there is evidence, but nothing published, available to the general public, that I grew neurons from 8-day-old chicken embryos. I'd dissect them from behind the eye, and I would put them in a tissue culture plate in a petri dish, and I'd dissociate the cells from each other. So they're all tightly bound together because they're creating vision for the chook. So I'd make them into a single cell population in the dish, and then I'd feed them. I'd make up the nutrient broth that I made, and I'd change that every morning, give them a new dose of food every morning. And then when they were ripe and juicy and healthy, we would treat them with chemicals. We would run the morning after pill, say. That was one of the ones that I worked with. We'd infuse it across the cells, and then we count how many nerve cells were alive after we did that or died, looking at the statistic. It was all done by my little thumb clicking on a clicker, I went on holidays and all my cells died. And I said, Mary, it was the lab tech who did the washing up and all of that sort of stuff for me. She was a brilliant woman. What happened? What did you feed them? And she said, oh, no, I didn't. I didn't feed them. Joe Bloggs fed them. Oh, okay. So I went into Joe Bloggs and said, how did you go with the cells? Did you do it Look, I did it every day, and every day they got deader and deader. They just died off. And I went, this is very interesting. So 2 things had happened. Mary had lived in a place called Broken Hill in Australia, which is in the middle of nowhere, no water at all. So one of the things you had to do with the glassware to do these particular tests was to rinse them in running filtered water 10 times. So you threw out lots of water. She decided she'd put them in a bucket. She'd have a bucket and she'd run them, and then she'd just take them 10 times through the bucket. The traces of chemical on the glassware, when he put my solution into the glassware and then pipetted it out, was enough to kill all the nerve cells. It was amazing. And then the next holiday I went away, I solved that problem. I came back and I looked at the cells and I said, Bill changed them once and He changed them 3 times and she did it 4 times. There was no physical evidence, but I knew who'd fed my cells.
Yeah.
From the way the cells responded to the people that were feeding them. And they were nerve cells. They weren't a being of any kind. And what is that? What is that? And then we could put a probe into the cell and we could put electricity through it and we could monitor whether it on a chart where it came up. We could do all sorts of things to these cells, but we couldn't find out why it knew who was feeding it.
That's
like, what? What is it?
Yeah.
It's amazing. And that we are that sensitive. I fully believe in homeopathy. And 20 years ago, I'd have gone, what a load of rot. That can't possibly do anything. I've had several people with motor neurone, Parkinson's, with MS, and I've seen the outcome of homeopathy in the most minute. A 5K dilution is 1 drop in a glass of water thrown out and refilled 5 times. What is that? It's amazing. But my husband, bless him, he had a heart attack and they fixed him and he looked really good. They brought him back to the ward and they put the stent in and I said, I'll go home and get some clothes and toothbrushes. And I did because the heart attack had happened on our farm overnight. And when I got back, he looked like he was dying. But when I left, he looked fine. And when I came, and I waited for the doctor to arrive, which thankfully was only a little minute or two. I said, what have you done? What's going on here? And he said, well, there are 12 pharmaceuticals that we put into him. And I said, look, if I have a headache, I take 2 aspirin. If he has a headache, he takes half an aspirin. He took him off 4 of the drugs immediately. What if I hadn't turned up? Anyway, our bodies are much more sensitive than we can ever imagine if we look at them through the dominant medical paradigm.
Yeah, and I talk about that a lot with my own clients within kinesiology, especially just that how, when we're using test markers and so on, how is the nervous system responding to that? And it's just because it's so perceptive, we don't realize how much information it's chunking and then filtering to us just the tiniest bit that we need as a kind of a more conscious operating aspect. I kind of often laugh about the fact that we're kind of like a glorified passenger in an amazing automatic machine that is doing so many things, at so much time that it's just impossible to really calculate. And if we really understood how complex all of that is and what we're capable of doing, I think we'd actually have a lot more faith in our body's ability to right itself as long as it has the conditions. And this is it. We understand the concept from a very basic idea of if our language towards a young person is unhealthy, if we're constantly criticizing them, putting them down, the likely outcome that we're going to have from that. And yet we don't think about how if we're taking on chemicals through plastics, chemicals in our food, stuff we put on our bodies, why wouldn't that suppress the system inside of it when it's adverse to a natural process in life? And, the other interview of yours that I listened to, one of the things that I heard you come onto in there was about this concept of spontaneous remission as well. And so I'm kind of a little bit curious about some of your experiences with that.
Spontaneous remission, it's very controversial.
Really?
What did I
well
say?
Documented.
Tell me what I said about response. I absolutely believe in spontaneous remission. 1990s, I think it was, 4 or 6, a guy called Mark Barash and a woman called Carol Hirschberg wrote a thesis on the properties of people that didn't die on time. And there were 6,000 American people in this study. They were given 3 to 6 months to live. And not only did they not die on time, they went on to live well without cancer. So what's that? So they decided in their thesis that it was 4 personal qualities. It wasn't about what they did. It wasn't about the carrot juice. It wasn't about the chemo. It wasn't about the exercise. There were 4 personal qualities. And I think that's what's true for me. I regained a sense of control over my commitment to living. And when we are out of control in any part of our life, that's a biological event that happens to us through neurotransmitter pathways. And we go down that same gurgler. We go down that old story about ourselves until we prove it. And it's like people being told they've got 6 months to live, or for me, 3 years, 3 to 5, that's all you'll get. That's what my first pathologist told me. The second pathologist, she had enough sense not to give it any limit.
Yeah.
Why would we? They're not giving me 3 years to live. They're taking away the rest of my life. It's not a gift at all. Spontaneous remission is a human choice. People choose. When people are ready to die, actually, there's a wonderful book by one of our Australian famous doctors. A television RPA was the Royal Prince Alfred Hospital television program, and he died of a brain tumour. His name's Chris O'Brien, and he was a very famous brain surgeon who died of a brain tumour. So they built a building in his honour of complementary therapies and research. Anyway, that's another story as well. He was talking to one of his colleagues, another brain surgeon, and he said, well, how long have I got? And he said, the other surgeon said to him, you and I know people go when they're ready. They go when they're ready. It's not a blame the victim thing. Dying is not losing.
Yeah.
It's not a blame the victim. It's that people, I believe, make choices. And sometimes it's convenient to be let off the hook. We had a young man on a program who had been sleeping on his, they had 4 daughters, little ones, and his wife was unhappy with him, so he'd been sleeping on the lounge for 6 months. And guess what he got? He got lung cancer, and he was so full of grief. In Chinese medicine, lungs are grief, so he was so full of grief and loss, and when he came to us, he could see no way forward, and therefore it was easier just to die and leave them the insurance money. But he chose not to. He chose to get up off the couch and reconnect with life and a commitment to living, and forgiveness. Forgiveness is giving up all hopes for a better path. It's about you, not about the other. Forgiveness is about you. And, when I got sick, what do I have to forgive myself for? Heaps. I'm a mother. Mother guilt is born into you when your baby's born. You're guilty from the moment they're born, We've all got a burden to carry. And sometimes when you sit down and make time to work yourself out, then all things are possible. And what if that's spontaneous remission? But at least they're saying the words now. 25 years ago, no, it was a misdiagnosis. They couldn't possibly have got better. Now they're going, spontaneous remission, maybe.
Huh?
And it's certainly, I looked at the time, I have to stop talking, but I just want to tell you one story about how important it is to know what you're doing when you're a therapist working with people that are on the edge of life. And I took 4 therapists into a 4-bed ward where 4 women were dying behind a curtain. Like how lack of privacy. It was a public ward, and first time we were allowed into palliative care, and I had these 4 young massage therapists going in. And I took them round to each person and asked them what we're going to do. Do you want a massage? The usual thing. And I left this beautiful woman who was only 47, and her daughter was sitting watching. And we put her into position and we rolled her forward onto a pillow so that we could massage her back from across her, leaning across the rails, leaning across her. And I said, look, she'll only stand about 10 minutes. That's the other thing, is when people are really sick, it needs to be short. Things need to be short. So I left her and I checked on the others. And as I came back, she was just rolling her back onto her back. And she looked into the therapist's eyes and she said, maybe I can die being massaged. you know. Our eyes filled up with tears. We tucked her in, and then we walked out, and there were 4 young doctors in the corridor with their charts and everything. And I said, "Oh, I'm so sorry we've kept you waiting." And the doctor said to me, "No, what you do is much more important. We're happy to wait for you."
Beautiful.
Because they know the benefit of it. They know what we do. But getting it to be through the institutions, through the interdoctor surgeries, 90% of people that go in with anxiety around something with their health would benefit for 15 minutes of Bowen before they went into the doctor. And they'd be able to think clearly, their blood pressure would come down, the white coat syndrome would be under wraps. It would be a whole different world of medicine. But maybe I'll have to, when I get to heaven, I'll go. Change
And
it
we'll
all.
keep working on it for sure, Eleanor. Thank you. And again, it's absolutely been beautiful listening. And, I can feel that wealth of experience and wisdom that's come from all of the years that you've dedicated into health and to caring for people. And so I'd love you to just share, for people that want to learn more about what you want to do, for people that want to learn about oncology massage, are there online training options as well and in person? Tell us a little more about how people can follow this up.
Yes, we have an online program. It's taught by Kate Butler, and Kate established the massage unit at the Olivia Newton-John Centre in Melbourne and spent 3 years there and working in the hospital, a mine of experience. But we don't need to start in hospitals. We need to start in our own backyard, in our own street. And there'll be people coming to you now that have got cancer that haven't told you. I mean, not every client tells you what's going on. So you need to understand what you're feeling, what you're touching, and when not to touch. So Kate's program, Oncology Massage Global, is in fact registered with, what's it called, something tree, so that you can get CPE points for doing the course if in England and Europe. What's it called? Oh, anyway, never mind. You can look it up on the website. We've got a website which is called oncologymassageglobal.com.au, and there's a free article on there called a freebie, and it's basically about 8 or 10 pages of hints on what you can do and what you can't do and how to take care of yourself. And I'd love everybody that's working with people to read it. You just download it from the web. And I've written a book which is called Touching Cancer. And it's basically the story of the last 25 years of my life. And it was very cathartic. I basically wrote it when I was really sick. And it was really part of my healing was to get this out, because it's been lonely. It's been a lonely journey. And it's that we've achieved amazing things. And I was privileged to witness some amazing things happening. So I've written a bit about it. Yeah. I think that's about all. Join associations. Don't work in isolation. Have colleagues around you. Create a network so that you become a respected person in your professional neighbourhood. These are really all part of integration, the vital parts of integration. And love yourself as much as you care for your clients. Be kind to yourself and take good care, because it's a long road between now and death. It's a long road. Yeah.
Beautiful. Thank you,
is that what
Eleanor.
you're imagining I'd say?
That's perfect. And we'll make sure that links to the website, to the article, to your book, they're all in the description on this interview as well, so people will be able to access those really easily. And, I think it's one of those fields that there's so much value in us as Bowen practitioners understanding your work, because to have that confidence to be able to work with people with cancer and know how to have the kinds of conversations that we need to have within that for the types of questions that we might get asked and how to best respond to those. Your work, your legacy is going to live well on beyond. So, and I hope that you're around to watch it for a long time yet as well.
Life's good. Life's good. I'm doing everything I can to contribute. I just want to be on my deathbed 50 years from now saying, that was a great life. Good life, well lived. That's my goal. Yeah.
Brilliant. Well, I hope and I wish that for you, Eleanor. Thank you so much for your time and attention today and sharing everything you've had. And everybody that's been listening in today as well, really, really appreciate your time, your energy, taking on board this stuff. And this is thanks from me and also from the BTPA, the Bowen Therapy Professional Association here in the UK. We're always welcome to have you with us. And we'll look forward. You mentioned Russell Sturgis in the talk today. We're fortunate enough we're going to be speaking to him soon as well. So,
He's amazing.
Looking forward to
it.
Yeah. So thank you very much. Take care, everybody. Look after yourselves.
Goodbye. Great. Thank you. Thank you and goodbye. Thank you for having me.